Good afternoon. Thank you so much for coming back, watching my YouTube videos. My name is Saima Uk. I'm a nurse from Pakistan, currently working here in the UK. If you're new to this channel, I would like to say a big welcome to you on this channel. I provide information about UK nursing, lifestyle of a nurse here in the UK, each and every bit about the lifestyle of a UK resident. All right, so in today's, if you are returning viewer, I would like to say a big thank you for watching my videos and also sharing the content and liking it, giving me support. I feel so happy and motivated making more videos for you guys. Thank you so much. So in today's video we are going to talk about if you are going to work in an elderly ward, what are the things you need to know and what are the pros and cons of working in an elderly ward or general medicine ward. So if you are interested in this topic, please watch the video till the end and we will discuss each and every bit about it. So as you all know, nursing here in the UK is a bit different from your own home country, and bedside nursing is different, ICU nursing is different. If you are going to work in operation theater, is totally different. So if you are new to this country, if you are coming as a new nurse to this country, you need to know if you are going to work in a general medicine or geriatric ward or elderly ward. Sometimes we call it OPMH also, older person medicine ward. So if you are going to work in these departments, you need to watch this video. So you need to know what are the things you need to consider before you sign the contract for these wards. So the first thing, as its name shows, elderly ward. So obviously, or geriatric ward. So obviously you would know it's a ward with elderly patients or older citizens, right? So you need to know that older persons, most of the times they have more dependency on the staff. That is our number one point. All right, so first we are going to talk about the things, you can say it like bad things or you time consuming things that you need to know before you start to work in an elderly ward. So what are the things that you are going to do in elderly ward that you don't do in the other wards, or you have some relaxation in the other wards, but in the elderly wards you don't get that relaxation, right? So here in the elderly ward, you can see obviously that elderly patients would have more dependency on the staff in terms of mobility, in terms of eating habits, in terms of skin care. So you need to know that you will be providing care on all those particular parts of the patient care, right? So I mean, with the skin care, elderly patients would be prone to their skin damage because most of the time they won't be able to turn themselves. So you need to give them time to reposition them, or you need to ask your healthcare support workers to help you with that, with the repositioning of the patient. So if you don't do the repositioning, they're gonna get the skin damage or pressure ulcers, right? So it is time consuming, and it's gonna, if you're going to work in elderly ward, you will be doing more kind of like dressings and pressure care prevention plan. You can do that, regular turnings and dressings also for the wounds. If they have pressure ulcers, you're going to do the dressings also, and then turnings of the patients, and then mobility wise you need to sit them out daily. So these are extra bits that you need to do if you work in an elderly ward. But if you work in a ward where you have only young patients, you are not going to do these things. They will be more independent. They can go to the toilet by themselves, they can change their pads by themselves, or they can turn or sit out on the chair also by themselves. So these are additional bits you need to know. Also if we talk about the staff dependency, they are elderly people, they are more dependent on the staff. So mobility wise also they need assistance. Sometimes they need assistance of one. Assistance of one means assistance of one person to go to the toilet or to turn, or sometimes they need assistance of two people or assistance of three people. So it depends on the on the condition of the patient. So this is the mobility term. So here also they need more support from the staff. So you will be doing these additional bits also, right? So skin check, we have done that. Skin bundle, that you will be doing the dressings, you will be doing the turnings and regular repositioning and making them sit outside, right? Sit out on the chair, right? So skin is the biggest problem here. Skin damage, we need to prevent it, so you will be more cautious about that. Number 1 point. Second point, we said already, is the mobility. They would be requiring more assistance from you. All right. Number 3 is the eating plan of the patient, right? Most of the time they would need your support. Most of the time they are on a red tray. Red tray means they need your assistance to feed them. They cannot feed themselves, so they need your assistance. Whether you can feed them or you can ask your support worker to help you with that. So let me make it clear for nurses. Most of the times the support worker, we are a team, we need to work together. All right. If you get time, you can feed the patient, you can turn the patient, you can go to the patient with the toilet. If you don't have anybody with you, you will be doing all these things by yourself. But if you have a healthcare support worker, they are really good. They are going to help you with that, with all those things. They can do the repositionings for you. They can feed the patients. Also, they can take them to the toilet. All right. You need to communicate with each other how you're gonna do the do these things, how you're gonna plan your day. All right. So just plan ahead. So first point we talked about, they are more dependent on the staff. They are more dependent on the nurses and the healthcare support workers. The second point is most of the times they are confused. They have dementia or Alzheimer's or delirium. So means they will be confused. What does that mean? Means they will be wandering around, some of them wandering around, or they need more support from you, more guidance from you, or so most of the times you need to provide one-to-one. Also, one-to-one means there will be one person with that particular patient who is very confused, agitated, or trying to get out of the bed, or trying to hurt other patients or you, all right, or staff, or trying to leave the ward. All right. So in that case, if you have any patient like that, you need to provide one-to-one. One-to-one means one patient, one staff, whether it's a nurse or a support worker, or so there should be one person for that particular patient. Or if the patient doesn't have capacity, all right, then only means they will be confused or they will be wandering around, then they need more support from you. You need to keep an eye on them all the time, right? When you're doing your medicines, or you're feeding other patient, or when you're behind the curtains, there should be someone taking care of that patient. There should be someone looking after that patient, because you don't want them to leave the ward, or you don't want them to put you in trouble, right? Or you don't want them to hurt any other patient, right? So you need to keep an eye on them. That's an additional job for you if you work in an elderly or geriatric ward. All right. So this is our second point, that if you're going to work in elderly ward, this is your additional job. Most of them are confused, so you need to pay close attention to them. The third point we are going to talk about is staff move. So if you work in general medicine ward or elderly ward, most likely the management, they are going to move you to the other departments if the staff is short. If there is staff shortage, if there is no staff in the other department or in the critical care departments, or let's say surgical high care, or any other department where they need more staff, or where they need extra help, they will move you from general medicine ward or elderly ward. Because most of the times elderly wards, they are more like a care home. You just provide the basic care, or you just provide them one-to-one meds, meals, personal hygienic cares and all those things. It's more like home care setting, you know. So the management, most of the time, they move you from that ward to an area where the patient needs you more. But obviously, if the other departments have enough staff, they're not gonna move you. But most likely they take staff from the general medicine or elderly ward because of the staff shortage. So you need to know that there will be point that you will be moved to the other departments. There is nothing wrong. We will talk about the good points in a later in this video. All right, so if they move you, you should not say that I'm not going, because you are not hired by the ward, you are hired by the trust. All right, so if they ask you to go somewhere, it's your responsibility to go. Just go, because what happen is no need to do arguments. At the end of the day, you are hired by the trust, you are there to work, whether it's your ward or some other ward. All right guys, just make a good rapport with your colleagues or your managers or your supervisors. If band 6s, they ask you to go somewhere, just go ahead. There's no point saying that I don't want to go, I cannot work. It feels like you're not competent enough if you say that I'm not going, or if you refuse to go. So I would suggest, if they ask you to move, just go ahead, because you will learn from it, honestly. So our fourth point is monotonous routine. If you work in an elderly or geriatric ward, routine of the ward is the same almost every day. There is nothing new, nothing challenging. Right, you need to be aware of that you are not going to do anything special. But obviously that emergencies can happen. You may need to do a CPR, but most of the patients in the elderly ward, most of them are DNAR, do not resuscitate. Most of them have that purple form, so you may not need to do that. All right, but most of the time the routine is the same. You don't do anything new, you just do the meds, IV meds or OBS, skin checks, dressings. Sometimes there is blood transfusion, sometimes there is IV fluid infusion also, but most of the times it's just IV antibiotics or oral meds. All right, and what else? Personal hygienic care. We don't do any special procedures, any particular, like you're not working in ICU, so you are not expected to do all those things, just normal. It seems like you are working in a care home, so nothing challenging, nothing new. But of course, if you are a person like to learn, you can learn from each diagnosis, you can learn from each patient, you can learn from their signs and symptoms. If they have any particular disease, you can learn from it. All right, so it depends on you what kind of person you are. But the routine of a nurse work environment is the same things they do every day. All right, so that's our fourth point. So these were the things that you need to be aware of if you're going to work in elderly ward. Now we're going to talk about the good things. What are the good things if you work in elderly ward or general medicine ward? The good thing is there are more opportunities for you to go to online learning programs, because what happens is, in our organization, most of the times, if you are working in a very busy department, or if you are working in an ICU, or if you are working in surgical high care, or MAU, you don't get a chance to go for study days. If you book any study day, you need to get permission from your managers beforehand, and sometimes it gets difficult that you don't get a chance to go ahead. But if you're working in a general medicine or elderly ward, they give you permission to go ahead and then learn or study. They don't ask you to just cancel that study day, or because they give you permission. Most of the times they have enough staff and they give you permission to go ahead and attend your study day, unless it's a critical incident, unless they are very short of staff. All right, so it's a good point that you get the opportunity to go and study. All right, and it's included in your study hours. That is really good point. The second point we are going to talk about is there are more chances of career progression. if there is any opportunity arise in the other departments or in your department, if a post comes for band 6, there are more chances of you being hired on that particular post, because what happen is there are more chances of you getting hired by for that particular post, because not a lot of people apply for general medicine, not a lot of people like to come in elderly wards, so there are more chances for you to get that post. All right, so there are more chances for you to get that post. You are more likely to get that job if there is post for band 6 or band 7. So if you are already an experienced nurse in your department and you're working in elderly or general medicine ward, you can get a higher post easily. And also you need to prove yourself. I'm not saying that you don't work, you're a lazy person, not working hard, not paying attention to your patients, or not paying attention to your work, and then you're gonna get band 6 post or band 7 post. No, you need to prove yourself, you need to work really hard to get that post, and also you need to do well in your interview. But what I'm saying is, not a lot of people, they don't apply in general medicine, a lot of people, they don't apply in geriatric or elderly wards. So if you are working in that particular ward, you are going to be hired for band 6 or band 7, more chances for you, all right, to get that job. So it's a good point for you if you're going to work in an elderly or geriatric ward. Also, a good opportunity for you to spend more time with your patients also comes here in elderly ward, because most of the times their relatives or their kids, they don't come, so you are there to support them, you are there to give them moral support, or give them psychological support, because most of times their relatives, they don't come, so you are there to help them with that. And then it makes a bond with between you and the patient, and which is really, really good. And the elderly people, they are so cute. They spend time with you, I mean, they speak very nicely, you feel like you want to spend more time with them, you want to sit with them, you want to have a chit chat with them. It's really nice feeling. And then it gives you opportunity also to open up, to give you a chance to understand them better and provide them better care. And also you can understand their feelings, you can understand their what they want to eat, or what they want to do, what they do in their free time. You get that time to talk to them and spend time with the patients. That is you are there for that. And it's really, really good that sometimes you get that you get that opportunity to sit and talk to your patients, even though sometimes even they are confused, they still speak to you, they still talk to you, and then they tell you their life stories or stories about their kids. And it feels like they just want to share their what's going on in their mind, they just want to share it with you. And it gives them satisfaction, it gives them hope, it gives them time to feel that they are looked after. All right, so if you are going to work in elderly ward, just prepare yourself. And honestly guys, if you're going to work in there, you need to get proper rest, because NHS is very, very busy, each and every department is very busy. So you need to know that you're gonna be very busy on the shift. Just prepare your mind before you come to the work, get enough rest, eat well, and then start your shift. All right, and wherever you go, I'm not talking about only elderly ward or geriatric ward, wherever you go in the NHS, it's very busy. So take care, look after yourself. All right, you need to rejuvenate yourself before you go to work. All right. So that's it guys for today. If you are going to work in elderly ward, these are the things you need to know. And if you like this video, please give it a big thumbs up and share it with your friends and colleagues who are coming to work in elderly or geriatric ward. If you have any doubts, let me know in the comment section. I'll be more than happy to answer your queries. Thank you so much for watching. Take care. Bye bye. God bless you.